Did you know the appearance, texture and color of your tongue says a lot about your health? So anytime you experience there's a change in color or texture of it, you have to know something is wrong with your tongue. In this video, I will explain what your tongue says when it's pale, bright red, has a thick white coating, has a black or hairy tongue. Again, I will explain what it means when your tongue has yellow coating or tint, cracked or fissured tongue, and when your tongue has a smooth or glossy tongue. But before I begin, you need to know the tongue is a muscular organ that helps you chew, speak, and breathe. A healthy tongue should be pink in color, be moist, and its texture should be slightly rough due to the small bumps on it. So, any significant change in color or texture points to an underlying issue. Let's delve into them. When your tongue is bright red, it can be a sign of a number of conditions, such as deficiency in vitamin B12, B9 and zinc. It can also mean you suffer from scarlet fever, Kawasaki disease, and toxic shock syndrome. You need to see a doctor if color persists, especially when accompanied by a fever. For a pale or whitish tongue, it could indicate there's low iron or vitamin B12 levels. Iron and vitamin B12 are important for production of red blood cells, so if your tongue is pale, do well to check your blood levels. A black or hairy tongue is oftentimes harmless. It can be caused by buildup of bacteria due to poor oral hygiene, smoking, tobacco, or some medications. Improving oral hygiene usually solves this. When there is a thick white coating on the tongue, it often points to an infection like yeast or oral thrush. It can also be due to poor oral hygiene and dehydration. If coating doesn't go away even after brushing, see your doctor. A fissured or cracked tongue is most times genetic, and it can be present if you have geographic tongue, Down's syndrome, Melkersson-Rosenthal syndrome. The cracks are harmless. However, if they cause pain, it might indicate an infection or vitamin deficiency. If your tongue has a yellow-coated tongue, it also signals buildup of bacteria, which can be caused by smoking and poor oral hygiene. It is also linked to acid reflux, psoriasis, and jaundice. Last to talk about in this video is when the tongue is smooth. The tongue should be slightly rough and bumpy. A smooth tongue can signal deficiencies like vitamin B and iron. It can also be due to glossitis, a condition that makes the tongue swollen and inflamed. It is caused by injuries, braces, spicy foods, dentures, or herpes. In wrapping up, if your tongue is constantly not pink, slightly rough, and without injuries or odor, you should get it checked out by your doctor. It could be something as minor as a vitamin deficiency or as major as an infection. Regardless, do not turn a blind eye to it. I will catch you in the next video. Stay safe and don't forget to subscribe to the channel.